just introduce myself. Good morning, everyone. This is the open enrollment overview for UC retirees. Welcome. I am Marianne McIver, healthcare facilitator, and joining me today is Tess Waldo, benefits operations coordinator. Today we'll cover the options that are available in the annual open enrollment period. And before we begin, today's session is being recorded for on-demand viewing, so please don't place any personal health information into the chat. That would make it difficult to make this available to others that aren't able to join us at this time. We will be covering questions today in live during breaks that are naturally occur after segments. So hopefully I have anticipated your questions, but if I haven't anticipated your questions, then I'll be answering those at breaks. And please, once again, please don't use personal health information. This is a summary of the topics we'll cover today. I'll begin with the basics around your open enrollment options, then shift over to medical plan updates. If you've received the open enrollment mailing at your home, you're aware of the headlines for open enrollment this year, namely, plans are changing. So you are in the right place to learn more. And then we'll go over who will be getting ID cards and Delta Dental plan enhancements for out-of-network dentists. This is a lot of information, so let's go. Open enrollment began on October 30th and continues until 5 p.m. on Friday, November 21st. That is the Friday afternoon before the Thanksgiving week. Open enrollment packets came or will come in an envelope with documents including how transition of care works when you change medical plans and other required notices that you should review. If you make a change during open enrollment, the new plan will be effective on January 1, 2026. The open enrollment website, ucal.us/OE, has the information about plan changes and links to lots of detailed information. And if you want to make a change, the link at the bottom of this screen gives you step-by-step instructions on how to use UC Raise. These are the types of plans that are available for enrollment through UC's open enrollment application. Retirees can enroll in or change enrollment in medical, dental, and legal coverage by making elections on UC Raise or by contacting the UC Retirement Administration, which I will call RASC. Retiree Vision Service Plan coverage is available to elect, as is pet insurance from Nationwide and AD&D coverage from Prudential. For the plans listed on the right, you contact the plan directly to enroll and make arrangements for payment of premiums. All details for enrolling are in the open enrollment mailing sent to your home and available on the open enrollment website. These are a picture of the contents and the open enrollment mailing sent to your home address. If you didn't get them yet, you can at the open enrollment website listed on the screen, or you may contact the UC Santa Cruz Benefits Office and we will share those with you. The UC Net Open Enrollment website has resources of information. The rates in the booklet represent the 2026 costs for retirees that are eligible for 100% of UC's graduated eligibility, so the maximum contribution. If you are eligible for less than 100%, then log into UC Raise and you can find your medical plan rates there. If you are not able to make the changes online or you find that you're locked out of UC Raise, never fear. You can make changes over the phone by calling RASC. Do so before the final days of open enrollment, if at all possible, because those phone lines do clog up on the last week of open enrollment. Faxed forms to RASC will be accepted until the 5 p.m. deadline on November the 21st. And if you or a family member is enrolled in Medicare, are making medical plan changes, please be sure to complete the appropriate forms for Medicare coordination and return any form that is required to RASC by November 26th in order to avoid plan disruptions in the new year. Before we going into the medical plan overview, I'm sharing information about how Medicare forms the foundation of UC retiree medical program and how Medicare works with UC retiree medical plans. So I'll go through this information quickly, and you'll have the slides for review if you want to take a longer look at it. UC has a requirement that retirees and their covered family members enroll in Medicare. If an individual is eligible for premium-free Part A, then they must enroll and pay for Medicare Part B premiums. This makes the UC Retiree Health Program sustainable into the future. Failure to comply with the requirement may result in loss of UC coverage, with the exception of those that live outside of the United States. When you have UC coverage and Medicare together, you have two insurance plans. The premiums for your UC plans are deducted from your monthly pension income from UC. The portion that UC pays is displayed as ER, which is an abbreviation for employer. And the pension that is deducted from your pension income displays as MBR, which is an abbreviation for member. Separately, on the right-hand chart, Medicare premiums you or a family member cannot be deducted from your UC monthly pension income. Premiums for Medicare are deducted from your Social Security income check, or you may make alternate arrangements, such as Easy Pay or paying premiums quarterly. Finally, if the Medicare plan that you are enrolled in has a premium that is less than the amount UC has budgeted to contribute, you may be eligible to receive a Part B reimbursement. This is money from UC that is intended to defray your Medicare premium costs and is only available for Medicare plans with the lowest premiums, so Medicare Advantage plans, or the plan without the prescription drug coverage. Medicare Part B Medicare Part B reimbursements are not a part of your pension income and are listed as a separate line item on your pension check. If you're eligible, you'll see those additions to your monthly check. If you're not eligible, they won't be there. If one is eligible for Medicare, there's two ways to coordinate your medical coverage with UC, with Medicare coverage: enrolling in a Medicare supplement plan or enrolling in a Medicare Advantage plan. And then in that case, a Medicare Advantage plan, you assign your Medicare risk to the Medicare Advantage plan, and that plan receives funds from CMS for taking on that risk. If you're of a certain age, you'll be receiving a lot of marketing from insurance companies that want to sell you an insurance plan to complement original Medicare. The good news is, if you plan on using your UC retiree medical benefits, then you can ignore all the marketing from non-UC medical plans. You can just put those right into the recycler. So to dive a little bit deeper into these plans, I'll first talk about Medicare Advantage plans offered by UC. We have two. Medicare Advantage plans offered by UC are Kaiser Permanente Senior Advantage and UC Medicare Choice, carried for UC by United Healthcare. If you are enrolled in these plans, you assign your Medicare benefits to the plan. You use the medical plan's ID card when you go to the doctor or the pharmacy, and you must see providers that accept both Medicare and your UC medical plan. Your Medicare coverage cannot be used separately from the Medicare Advantage plan because you've assigned your Medicare benefits to the Medicare Advantage plan. And Medicare Advantage plans may require prior authorization for some services. And that's just, that's for all insurance plans, including Medicare. Now on to the Medicare supplement plans. When you are enrolled in a Medicare supplement plan, sometimes called a Medigap plan, you are covered by two insurance plans. Therefore, coordination of benefits from the two plans is needed. When you receive any care, you must bring both your red, white, and blue Medicare ID card and your ID card for your secondary Medicare supplement plan. UC's Medicare supplement plans are carried by Anthem Blue Cross. You must receive care from providers that accept Medicare, and luckily the overwhelming majority of doctors do accept Medicare in the United States. Some providers, such as psychologists or psychiatrists, do not accept Medicare. For those providers, you can still receive care from those providers under your UC health plan provisions. And your Medicare won't pay for any of those services because that provider doesn't accept Medicare. As is the case for all UC insurance plans, sometimes prior authorizations are required, for example, before a planned surgery. Per the Medicare Modernization Act of 2003, enrollment in a prescription drug plan that meets Medicare Part D specifications is a requirement. Your UC plan can be your Medicare Part D plan. Once again, if you get your Part D coverage from UC, you can disregard the advertisements from and mailings from insurance companies that are marketing towards you. In fact, enrollment in a non-UC plan can cause problems because enrollment in more than one Part D plan on any date is not allowed under Centers for Medicare Services rules. If you decide a Part D plan outside of UC offers better coverage that better meets your needs, the UC Medicare PPO without RX could be an option for you. To select this plan, when you enroll, you will be asked to provide proof of non-UC coverage for Part D coverage. And this is in order to avoid a CMS penalty. If you have it, in order to avoid a CMS penalty. The Inflation Reduction Act provisions also cap the out-of-pocket prescription drug costs for Medicare Part D plans, and I'll talk about those when we get to the specific plans. So this chart shows the movement when any person is covered by a UC retiree medical plan and then transitions to the Medicare coordinated coverage. The plans listed are where Medicare eligible members will move upon enrolling in Medicare, which is a requirement for eligible retirees and family members. In the blue ink are HMO plans, which transition to Medicare Advantage plans. In purple ink on the left-hand side are the UC PPO plans, which transition to Medicare Supplement plans. UC retirees and their covered dependents are required to coordinate coverage with Medicare if or when they become eligible. Generally, there is not an opportunity to change a medical plan on account of becoming newly Medicare eligible. So take note of the Medicare companion plans that complement the non-Medicare plans. As well, the UC Health Savings Plan and Core Medical Plan are terminating on December 31st, 2025, which we'll cover in the next several slides on medical plan changes for 2026. So I just want to call that out, that folks enrolled in those plans will need to make a selection for 2026 because those plans will not be offered beginning on January the 1st. And then open enrollment is, of course, the time of the year to make those changes. So you're in perfect timing to do this. Okay, so let's start with an overview of the types of plans and the changes for 2026. For 2026, UC has made some significant changes to the menu of options. First, the left side of the list, non-Medicare retirees. UC is continuing to offer two HMO plans, UC Blue and Gold, carried by HealthNet, and Kaiser Permanente HMO. PPO offerings in 2025 are UC Care, UC Health Savings Plan, and Core, and Anthem is the carrier in 2025 for UC's PPO plans. That will change for 2026. Two of these plans are going away. Core and UC Health Savings Plan will be discontinued on December 31st, 2025. Replacing these two plans is the one plan, Health Savings Plus. Health Savings Plus is a PPO medical plan carried by Blue Shield of California and is not compatible with Medicare because it has an HSA that is created when you enroll or default in the Health Savings Plus. And UC partially funds the HSA, which is contrary to IRS regulations for Medicare eligible members. So we'll talk about those changes as we go through them. On the right-hand side of the screen are the plans that coordinate with Medicare. These plans are not changing in 2026. They will remain under the Anthem Blue Cross. So I'm talking specifically about UC Medicare PPO with or without prescription drug coverage and UC High Option. The Medicare Advantage plans that continue to be carried by United Healthcare are UC Medicare Choice PPO, and Kaiser continues to carry Kaiser Permanente Senior Advantage. For those that live outside of California, The benefits continues to be the UC Medicare Coordinator Program. So over the next several slides, I'll talk about these medical plan changes. First, though, I'll go through some generalities. This slide applies to all UC medical plans. UC medical plans have no pre-existing condition exclusions. Your home address determines which medical plans are available to be selected. For example, if your residence is outside of California, you won't be offered an HMO plan to select. And if all family members are eligible for Medicare, you'll probably be transitioned to the UC Medicare Coordinator Program. No duplication of coverage is allowed in any category of coverage. For example, no double medical or dental coverage is allowed if you have a UC spouse, whether they're retired or actively working. You can't have duplicate coverage. In the U.S. healthcare industry, when any person is covered by more than one insurance plan, there is a determination of which plan pays first. This is called coordination of benefits and should be a concept that is familiar to anybody who's gotten to a fender bender and it has car insurance. There's coordination of benefits there too. If you're covered by UC health coverage and you have coverage under a non-UC plan, say by a spouse's employer's benefits, then you are subject to coordination of benefits and may want to follow up with me for additional consultation about your particular plan. If two parents are both covering a child, then the birthday rule applies. The parent with the birthday that falls earlier in the year will be carrying the primary coverage for the child. For example, if one parent is born in June of any year and the other parent is born in November of any year, the parent with the June birthday is the primary coverage for the child. And any new family members added during the open enrollment period will be verified by UC in the new year by Unify HR. UC medical plans all have behavioral health benefits that are equivalent to medical benefits. These are available to you and the costs are the same or less than the cost for receiving medical care. All UC plans include access to covered acupuncture and chiropractic services. Another legal requirement is that access to preventive care such as adult wellness exams, well child exams, well woman exams, screenings, and vaccinations. And these are all at no cost to the member. Telehealth and virtual care over a phone or tablet or computer can be a great way to quickly obtain care when your primary care physician is not available right away, or if you're not sure whether to go to an emergency room. All UC's medical plans have access to telehealth and virtual visits, often with no copay, or for medical plans with health savings account, very reduced costs. And the links on this page are active. So you can click on this page when you receive the slide deck to find out more. So over the next several slides, I will talk about these medical plan changes. I'll go over first the non-Medicare HMO plans. UC offers UC Blue and Gold and Kaiser Permanente HMO. Once again, these are both continuing into 2026. If you're currently enrolled in either plan and make no changes to your medical plan, these HMO plans will continue with any appropriate premium changes. Some generalities about medical plans, specifically HMO medical plans. UC offers two, and they're available to California residents only based upon your home and work address. So they're available in urban areas, but not every county in California. HMOs are prepaid medical plans, and there is no coverage available for out-of-network care, except for emergencies. HMO plans are managed care plans, meaning they are subject to the California Department of Managed Care requirements, and HMO plans can be compatible with flexible spending accounts if you have one of those through continuing employment or through a spouse. If you reside in Santa Cruz County and you elect the UC Blue and Gold plan, Dignity Health will be your primary medical group. Dignity Health Santa Cruz is part of the Canopy Health Group. Through Canopy, access to UCSF specialists is available by referral. Kaiser Permanente is available to those that reside in Santa Cruz counties as well. And if you elect the KP plan, you and your family will receive your services at Kaiser offices in Santa Cruz County or sometimes Santa Clara County. There is primary care now available in Salinas. Examples of services in Santa Clara County are planned hospital stays and Salinas has primary care and OBGYN services. As well, Kaiser continues its relationship with Watsonville Community Hospital, and you can have planned surgeries there as well, with Kaiser doctors and nurses serving you while you stay. If you reside in another county, you can use the Find a Doctor tools on the HMO websites to see if there is availability in your county. A family member can have a different primary medical group than you. That's absolutely fine. I just talked to a parent this week whose child is going to school in San Diego. So that is available for them to have a split family. And if you or a covered family member move out of an HMO service area mid-year, it's your responsibility to contact UC Retirement Administration within 31 days of your move to update your address and to receive assistance in selecting a new medical plan that can provide comprehensive care where you live. So the advantages of HMO plans are that you know what you'll pay for care in advance because they are prepaid. There are no annual deductibles to satisfy. The prescribed co-payments with no deductible can make your planning for medical costs more predictable. And because there's an assigned primary care physician, that relationship encourages members to keep up with their preventive care. As well, since your primary care physician directs all your health care, it's easier to use than a PPO plan. However, you are limited around service area requirements. You have to live in an urban California zip code, and as do all family members. And with HMOs, there's a more limited network of doctors to select from. Your primary care physician will refer you for all specialty care, and they will direct you only to other in-network providers and hospitals. There's virtually no out-of-network care available except for emergencies. And if you're covered by an HMO and need urgent care away from home, call your primary care physician to obtain permission, or telehealth or virtual care is a good option in that circumstance. Of course, if there is a life-threatening emergency, then proceed to the nearest emergency room for emergency services. Okay, so very quickly are some legislative changes. Among the changes that applies to both of UC's HMO plans is a California state mandate, SB 729, and it renews the benefits that have been used under UC provisions around infertility care. If you've exhausted their limit already under the HMO plans, then this renews the provision beginning on January the 1st. As well, these expenses can apply to your maximum out of pocket. Other mandated requirements with varying effective dates for our HMO plans are summarized as follows. AB 3059 was implemented earlier this year, and the bill established a provision for human donor milk to make distribution easier. The Children and Youth Behavioral Health Initiative requires fully insured plans to provide coverage if a child utilizes behavioral health benefits at the school. And AB 2843 provides for coverage at no cost for 9 months following rape and sexual assault for various health and wellness services connected to recovery from that assault. Okay, this change for 2026 may have broader impacts. A key change across all of UC's medical plans are new limits on weight loss medication, such as GLP-1s, or known by names such as Ozempic or Wegovy, among others. Currently, in 2025, a body mass index, or BMI, of 30 is required, or a BMI of 27 with a comorbidity allows for coverage of weight loss medications. Beginning in 2026, the criteria is changing to a beginning BMI of 40 or greater. For existing members currently using these medications, they can continue to do so if the prescribing physician provides a certification for medical necessity and you meet the criteria for prior authorization for continuation of therapy. So members newly using the medication in 2026 will be required to have a body mass index of 40 or greater. This change doesn't affect the eligibility or coverage for those with type 2 diabetes that are continuing. However, members do need to work with their providers to determine next steps on coverage for these medications. They're going to be limited in 2026. And those were the changes for 2026. So just again, a mini overview of UC Blue and Gold. UC Blue and Gold is carried for UC by HealthNet. UC employees residing in Santa Cruz County have Dignity Health. They're also part of Canopy Health, allowing access to Watsonville, Dominican, UCSF, and other hospitals and medical groups in the greater San Francisco Bay Area. We had a presentation yesterday to learn more about those plans, and those will be becoming available soon once we have that video rendered. And you can reach out to Canopy Health at the email provided on this page if you need help with referrals. To confirm, the Palo Alto Medical Foundation and Stanford Health do not accept the UC Blue and Gold plan. Care from those providers is not available and not available for coverage. If you have a mixed Medicare family, the UC companion plan to UC Blue and Gold is UC Medicare Choice Medicare Advantage plan carried by United Healthcare. And then moving on to Kaiser, just a mini overview like the other HMO plan we just covered. Kaiser Permanente is a California-based HMO with no annual deductible and prescribed dollars copayments when receiving care. For some services, you may need to travel to Santa Clara County, and there's some primary care available in Salinas. With Kaiser, you can use Watsonville Community Hospital or the Santa Clara Kaiser Hospital locations. There is no Kaiser dedicated hospital in Santa Cruz County. There is Watsonville Community Hospital. Kaiser continues to broaden their providers across Santa Cruz County for local care, like specialists, physical therapy, durable medical equipment, but sometimes folks do need to travel to the Santa Clara locations. And Kaiser will be presenting to UC Santa Cruz on November 5th and 18th. If you'd like to attend that presentation, please visit shr.ucsc.edu for details. The Medicare companion plan to Kaiser HMO is Kaiser Permanente Senior Advantage, a Medicare Advantage plan. And finally, I'm confirming that the behavioral health coverage is bundled with the HMO medical plan with links embedded so that attendees of this presentation can find more information if needed. Next, moving on to the Medicare Advantage plans. First up is Kaiser Permanente Senior Advantage. And there in 2026 for Kaiser Permanente Senior Advantage members, the Medicare Part D TROOP or True Out-of-Pocket Maximum is increasing from $2,000 to $2,100. This is a legislative mandate for Part D plans. And in 2026, there is an increase to emergency room copays from $65 to $100. And the hospital stay copay is also increasing from $250 to $350 in 2026. The ER visit copay is waived if you are admitted to the hospital from the emergency room. And that's the change, or those are the changes for Kaiser Permanente Senior Advantage. So I will move on to the next Medicare Advantage plan, which is UC Medicare Choice, the Medicare Advantage plan carried by United Healthcare. And this is the plan that UC Blue and Gold members transition to when you begin Medicare. For 2026, the UC Medicare Choice Plan has a number of changes. Changes are beginning to the ER visits in the US and abroad are changing from $65 to $100. Inpatient and behavioral health hospital stay copayments are increasing from $250 to $350 in the new year. UC is adding a Part B medication copay of $30. That will match the office visit copay, which is where Part B medications are generally administered. For Part D, as in David, prescription drugs, in 2026, there will be a $100 deductible for prescription drugs in tiers 3 and 4, accepting insulin. So those are the non-preferred brand name and specialty medications, accepting, of course, insulin products. The copay for specialty drugs is also changing from $30 to 30%, up to a maximum of $150. per prescription. Medicare Advantage Fitness Program is returning to Renew Active from Silver Sneakers. So this is a boomerang back to Renew Active after 1 year with Silver Sneakers. Beginning in 2026, the Personal Emergency System, or PERS, will be discontinued for UC Medicare Choice members. Members that have the Personal Emergency System and want to continue should contact United Healthcare directly at the number listed on their ID card. And the Calm app that provides online guided meditation, movement for improving mental outlook, and other anxiety coping strategies on your mobile device or computer is expanding in 2026 and will be covered beginning in January. The UC Medicare Choice folks are available, and they have a pre-open enrollment online chat where you can talk with a United Healthcare representative, and the link is on the screen if you would like to take part in that. So I will go ahead and confirm if you're satisfied with your UC Blue and Gold HMO, or Kaiser Permanente HMO, or Kaiser Permanente Senior Advantage, or UC Medicare Choice Medicare Advantage. No action is necessary during open enrollment. You can do nothing, and those plans just continue with any rate changes effective on January 2026. So moving on, as I said, there's big news about UC's PPO plans, and CORE and UC Health Savings Plan are ending at the end of the year with a new insurance carrier and the addition of Health Savings Plus, which is taking the place of both CORE and UC Health Savings Plan. So those are the non-Medicare plans. Over on the right-hand side of the screen, UC's Medicare PPO plans with and without prescription drug coverage and UC's high option supplement to Medicare will be the plans that I go over the next few slides. So first, I will cover some PPO plan generalities as a mini overview. So first, I will talk about the non-Medicare medical plans that are undergoing changes for 2026. We're replacing UC Health Savings Plan and CORE with Health Savings Plan, a medical plan with a deductible that is less than CORE, but is higher than UC Health Savings Plan. The Health Savings Plan, the Health Savings Plus plan comes with the Health Savings account, partially funded by UC. And just to be clear, an HSA is not a flexible spending account. UC has selected Blue Shield as the new insurance carrier for both UC Care and UC Health Savings Plan. UC Care and Health Savings Plus. I might make that mistake, and I apologize. I'm just so used to saying the other plan. So Blue Shield is the insurance carrier in 2026 for UC Care and Health Savings Plus. And the elimination of CORE medical plan means that families with mixed Medicare enrollments like CORE alongside UC Medicare PPO carried by Anthem Blue Cross will have default enrollments that will replace CORE with UC Care. So I'll talk about that in just a few slides, but I do want to make sure that is clear that mixed Medicare families will have an impact. CORE is not going to be available to continue in 2026. Okay, some similarities amongst all of UC's PPO plans. Before I get into specifics, I want to cover generalities. As I said, Blue Shield is the insurance carrier for the non-Medicare plans. So they all have the same network of doctors in the United States, and there are providers available outside of the United States too. What you pay for medical care is dependent upon whether the care you receive is from an in-network provider or an out-of-network provider. And for all UC medical plans, only care that is medically necessary can be covered. So there are multiple advantages and limits with belonging to an HMO plan. The advantages I've talked about, there's no need to stay with a primary care physician. Care can be received anywhere, and if you stick within network, there's no balanced billing. However, the limits of PPOs that other than preventive care, an annual deductible usually needs to be satisfied, and patients don't know what their costs are in advance because it's based upon a percentage instead of a prescribed copayment. Out-of-network providers can be especially expensive to use, and a prior authorization is required for things like imaging, hospitalization, durable medical equipment, transplant, and some prescription medications. This is a chart intended to inform you of the PPO networks. Health Savings Plus and UC Care are Blue Shield plans. Blue Shield of California. Both of these are non-Medicare plans. UC High Option and UC Medicare PPO is with Anthem Blue Cross. That's not changing in 2026. UC Medicare Choice is the Medicare Advantage plan that has the United Healthcare network. And for the plans listed in red ink, you have to use providers that accept Medicare with some exceptions. Moving from generalities to specifics. First up on the PPO plan is the medical plan that's continuing, UC Care, and Blue Shield is replacing Anthem as UC's administrator of UC's PPO plans. The plan design is not changing. UC Care will have 3 tiers of coverage, meaning you can see any doctor that will see you, and what you pay for care is determined by whether that provider is Tier 1, UC Select provider, a preferred provider, or Tier 2, where annual deductible applies. And when satisfied, the plan covers 70% of the cost. And out-of-network benefits for coverage of medically necessary care from providers that do not accept Blue Shield. Remember, balanced billing will often apply for out-of-network care. There is a very high amount of overlap between Anthem network of providers and Blue Shield's network of providers. And folks that aren't with the Blue Shield are receiving letters now. The UC Care PPO plan is continuing into 2026. And if you're enrolled now and take no action during open enrollment, you will remain in UC Care. I'm sorry, I just have to step away for a moment and plug in my computer. This will take 2 seconds. And I'm back. Thank you for your patience with that technical. The relationship through the transition to Blue Shield with Accolade continues, and Navitus will continue to be the pharmacy benefit manager for UC Care. The doctor networks for 2026 are available now on the UC PPO plans open enrollment page. The largest medical groups in Santa Cruz County are both Tier 1, namely PAMP Santa Cruz and Dignity Health Santa Cruz. These custom network relationships will continue, and UC does have an intention to have Tier 1 networks in the areas surrounding UC locations. You can find links to both Tier 1 and Tier 2 providers at the open enrollment transition page at uchealthplans.com, linked from the open enrollment page. Full disclosure, UC Care is a PPO plan, and accordingly, I always advise that even with diligence in seeking out Tier 1 providers, members should be prepared to encounter the Tier 2 coverage deductible. Some services are just not available at Tier 1. This most often occurs for labs that perform specialized tests, durable medical equipment, think wheelchairs, orthotic inserts, and so on. The primary takeaway is there's no guarantee that your healthcare will be available at the Tier 1 coverage level. So in terms of significant changes for both UC Care PPO and Health Savings Plus, other than the new insurance carrier, there's a change in the pharmacy benefits affecting some members. Navitus has a program called Access Guidance Services, and this program helps members that are prescribed specialty medications, think HIV medications or GLP-1s, and other classes of high-cost medications filled through Lumicera. The program will continue to be offered through Navitus. Navitus and Lumicera will continue to support members with enrollment through outreach calls and through mailers. Members obtaining medications through retail can also have manufacturer copay assistance. However, once the copay assistance through this program is exhausted, the member returns to the customary pharmacy benefits of their plan. In 2025, the savings for members accumulated towards the out-of-pocket maximum. In 2026, the payments made through the copay assistance program will no longer count towards your maximum out-of-pocket. So impact letters will be sent in October 2025, and members that are affected by this are those that receive high-cost prescription medications. So it may not apply to everyone. Also, next year, Weight loss drugs will be available only for those that have a starting body mass index or BMI of 40 or greater. Members should contact Accolade to begin work with their prescribing physician. Letters to affected members are being mailed now. The letter reads, "This change requires a new prior authorization. For continued coverage of this medication, please ask your provider to complete the new prior authorization after January 1, 2026. So that's how you do it. You just read the letter and follow those instructions. I don't have a way to cut you to the front of the line if you're affected by that. As stated previously, Blue Shield is replacing Anthem as the administrator for UCPPO plans that are non-Medicare. Core Health Savings Plan are going away with the default into Health Savings Plus. UC Care is continuing, but with Blue Shield. And Health Savings Plus comes with an HSA. With the change to Blue Shield, I have linked to Find a Provider tool to help you search for in-network providers. And this link is available on the uchealthplans.com page. So a little bit around the new medical plan over the next few slides. Since Core and Health Savings Plan will not be covered next year, some comparison charts are provided. Core will be terminating December 31st. The chart here shows the Blue Shield will be the carrier for the replacement plan, and Health Savings Plus is a plan that comes with an HSA. Accolade will remain the member services contact, and Navitus will remain the pharmacy benefit manager. And Health Equity will stay on as the HSA custodian for the new plan. Here's a comparison of the calendar year deductibles and out-of-pocket maximums. They are increasing next year in comparison to the health savings plan, except for the out-of-network maximums. All family deductibles are non-embedded. There's only one combined family deductible and an out-of-pocket maximum when covering more than one person. So there's only two ways to be enrolled: single, covering yourself, or family. And these are the applicable maximums that apply. The member cost share for preventive care remains $0 for in-network care, and the out-of-network preventive care will have a 50% coverage after deductible is satisfied. Cost share for doctors, specialists, labs, imaging, mental health, maternity care, hospitalization is increasing to 30% for in-network and 50% for out-of-network, plus the possibility of balance billing. Here are the member cost shares for Accolade Care, virtual second opinion, as well as acupuncture and chiropractic services. The costs are increasing next year from 20% to 30% cost share for acupuncture. And the cost share is increasing from 40% to 50% for chiropractic care next year. Member cost share is also increasing from 20% to 30% for urgent care, emergency ambulance transport, and care from retail clinics, along with an increase from 40% to 50% cost share for out-of-network urgent care, plus the possibility of balance billing. And prescription medications are also covered in the same way that medical services are. The deductible of $2,500 for single party or $5,000 in network for family coverage must be satisfied, and thereafter the plan covers 70% of the member responsibility, 70% of the cost, leaving the member responsibility at 30%. Health Savings Plus members are motivated to seek in-network pharmacies for the better benefit. And that was a really quick overview of the comparison portion of this plan. For more details, please visit the Open Enrollment website. The new Health Savings Plus plan comes with the HSA, which which is partially contributed to by UC. UC contribution is increasing for 2026 compared to the health savings plan. Currently, UC contributes up to $500 or $1,000, and that is increasing up to $750 for self-only coverage and up to $1,500 for self plus others for family coverage. IRS also increased HSA contribution limits, which I won't go into because pension income isn't eligible for HSA contributions. However, members can make after-tax contributions and should contact Health Equity, which remains the custodian and will continue to look over the accounts on deposit. And the reminder that HSA is not a flexible spending account. That's a different type of tax plan. So there are IRS limits on who can be enrolled in Health Savings Plus. It's that health savings account that comes with the Health Savings Plus plan that makes it incompatible with IRS requirements for some. First are those individuals that are covered by an FSA, say through another family member, or if you retired in the middle of the year, you may still have an FSA in the current year or in 2026. You may not enroll in a medical plan that has an HSA. Again, it's that HSA that comes with the health savings plan that makes it incompatible according to IRS requirements for Medicare eligible members. And I've linked to the Medicare publication that talks about those limits. So if you are already enrolled in Medicare or you have a split family enrollment, the transition to the HSA is not appropriate. If you have the health savings, if you are currently in core or the health savings plan, you will be transitioned to UC Care with Medicare PPO if you have a family member that's eligible for Medicare. You cannot select the core plan. It's going away, and members with Medicare cannot be covered under the health savings plan. So on the right-hand side shows the default enrollment that will occur for members that are currently enrolled in plans listed on the left side of the program. For example, if you're covered by UC Medicare PPO, but your child or your spouse is too young for Medicare and is covered under core, in those cases, the Health Savings Plus enrollment is prohibited under IRS regulations, and those families will be defaulted into UC Care PPO with the Medicare Companion Plan of UC Medicare PPO. Okay, we're getting into the home stretch. That brings me to among the most popular of the plans for UC retirees, UC Medicare PPO with and without Part D coverage. So in this section, I'll also cover the UC Medicare PPO and high option supplement to Medicare. As always, I'm beginning with some generalities. So UC's Medicare supplement plans will continue to be carried for UC by Anthem Blue Cross. If all family members are in an Anthem plan, no action is needed during open enrollment, and these plans will just continue. Medicare is primary with these plans, and prior authorization is less frequently required than under Medicare Advantage plans. However, you must use any Medicare providers for Medicare covered services. You can use licensed providers for behavioral health, but when receiving medical care, you must use Medicare providers. There is a coverage and coordination with Medicare paying first and the Medicare supplement plan paying second. For the plans with prescription drug coverage, you see Medicare PPO with RX and high option. Navitus is the pharmacy benefit manager with a 4-tiered Part D prescription drug plan with prescribed copay. And if you are interested in the UC Medicare PPO without prescription drug coverage, you do need to provide proof that you are enrolled in a Part D plan. Narrowing our focus to the UC Medicare PPO, there are no major plan changes for next year. The Medicare deductible does not apply. Medicare covered services are billed to Medicare and then to Anthem Blue Cross plan, leaving a patient responsibility of about 4% of the Medicare contracted rate. If the service is not covered by Medicare, such as for psychology services, then a deductible of $100 applies, and Anthem plan covers 80% for most services, leaving a 20% patient responsibility. And for examples of services not covered, by Medicare are things like hearing aids, acupuncture, care from marriage and family therapists, and services outside of the United States. If using behavioral health services, it's best to use in-network providers, but out-of-network coverage is available with a patient responsibility of 20% of the contracted rate, and you may be subject to balance billing. Again, no major changes to the UC Medicare PPO except for premium changes. The UC Medicare PPO is maintaining the prescription drug co-payments into 2026. As is true with all of UC's prescription drug plans, savings for routine and ongoing medications can be achieved by obtaining 90-day supply of prescription through mail order or through the participating pharmacies. The true out-of-pocket maximum for prescription drug co-payments in 2026 will increase by $100 to $2,100. Like the UC Medicare PPO, no major plan changes to the UC High Option Supplement to Medicare. For most medically necessary services, after Medicare and Anthem pays for services, you have no additional costs. The exception for services that are things that are not covered by Medicare. And there is the separate prescription drug coverage. There is the true out-of-pocket maximum protection for our copayments, which maxes out at $2,000, according to the benefits of this plan. So if you're happy with UC Medicare PPO with or without prescription drug coverage, or you are happy with your UC High Option Supplement to Medicare, no action is necessary during open enrollment, and those plans will just continue. So I'm going to stop here and see if there are any plans, or excuse me, if there are any questions about plans, and I'll ask Tess to it.
Yeah, so let me get back to the first questions here. So an employee asked if the new Health Savings Plus plan covers international, including RX. The current core plan does. So just some clarification on that.
Right. The Health Savings Plus plan is an IRS mandated plan, which means it has very limited services outside of the United States. It has emergency services covered. If there was an international medication obtained, you'd have to submit that for reimbursement, and the plan would determine if that would be available for coverage.
Another question, and I'm sorry I was answering emails during this portion, but did you mention, Marianne, that there is a UC Net video regarding specifically the Medicare PPO plan? I couldn't find something like that.
No, I don't think that I said that.
Okay.
There is on the UC health plan pages transitioning to Medicare video, which a lot of people find helpful, and on the uchealthplans.com. There are also other short videos which you are encouraged to go view.
Yeah, and also,
but there's not an overview. This kind of is the overview.
Yeah, and I provided you, the person that had the question, a link to our recording for you to review that Marianne just did on recently in October.
Okay, let's keep moving along.
The next question is, if this year you choose an Advantage plan, you see blue and gold, can you change that to a supplemental plan PPO with Medicare next year during open enrollment?
Yes. In the individual Medicare marketplace, there are restrictions often encountered by folks. So the value of belonging to the UC program is that you have the benefit of participating into a larger risk pool. So yes, you can switch from a Medicare Advantage plan to a Medicare supplement plan offered by UC because you're in the UC pool of risk, and so there's no underwriting necessary. Next question.
Okay. Next question. What is the path forward now if split family enrollment will happen in the middle of 2026? No PPO international coverage for younger partner?
Okay, if the person is a split Medicare plan beginning in 2026, I would advise that they would probably just be best off starting off with UC Care so that you don't run into tax issues later on in 2026. However, if you want to follow up with me individually with that question, I'm happy to talk it through with you. I'm not sure I kind of got all of your question, and you're welcome to reach out to me individually. However, I will say the IRS prohibits anyone will impose penalties on receiving a health savings account when you're concurrently eligible for Medicare. It may be worth it to incur those penalties to you, but that is, I can't provide tax advice. I'm specifically prohibited. So UC Care enrollment would be the way to avoid any IRS entanglements.
Okay, the next question. The open enrollment info shows the deduction of $120.88 for the UC Medicare PPO for me and my husband, both on Medicare. This is less than I'm paying now.
I'm going to pause you right there. I'm going to talk about medical plan premiums as we go ahead, and I'm not going to get into any individual calculations for family members in this group setting.
Okay, all right, got it. So please clarify the difference between UC PPO versus high option PPO.
The difference is very little. The provider network is exactly the same. The premiums are higher and they are going up significantly in 2026, which I'm going to talk about in just a moment. So for folks that are in the high option plan, look critically because costs going up mean that you may wish to make a change. And are there any other questions?
Yeah, there's lots. So another one came in. UC is cutting off international retirees from medical coverage.
No, UC continues to have UC Care, which has out of the United States medical coverage under that's still available. So that is a misunderstanding. UC Care is the international plan.
More questions about rates, you need to look at the information there and on
Yeah,
the
I'm not doing
page.
individual rate
Okay,
questions
and
in
another
this
one,
group setting.
yeah. So another one came in. How can one find a doctor if the doctor's covered both United Healthcare and Medicare? So
You can go to your plan's website to find doctors that are in network. That's my advice for go to from the open enrollment website, go to the medical plans website. It's linked on the left-hand side of the screen. All of the medical plans have a find a provider tool and use that tool to find providers.
and a question, comparison. There is many comparison tools from the open enrollment site that you can take advantage of. Go to UCNet to find all those comparison tools. And this group, I did send prior to the meeting, which plan should I choose publication. That's a great one to reference. So that was another question. And then more questions about doctors. Again, you will want to go to your plan to review the doctor provider lookup tool. UC Medicare PPO has no deductible for services covered by Medicare then?
Correct.
Okay.
Both plans pay, but there's not that $100 deductible does not apply. And then I see if I'm currently in UC Care, non-Medicare, over age 65 and do nothing, I will be automatically transferred to the new UC Blue Shield UC Care. Correct. UC Care members keeping UC Care through the transition into 2026 will be automatically placed in the Blue Shield plan. And I'm going to get going now on the next section because I think we've covered all of the questions. Member ID cards. Now on to who should expect to receive them. Virtually everyone will receive new ID cards except those continuing Kaiser members. So only new members of Kaiser Permanente HMO will receive new ID cards. Everybody else that's continuing will continue to use theirs. UC Blue and Gold will send out new ID cards. UC Care PPO, with the change to the new carrier, will receive new ID cards. If you have a health savings account, an HSA, you can continue to use that card. If you are a new member, you'll receive a new card. But if you are continuing through the transition from the Health Savings Plus plan to Health Savings Plan to Health Savings Plus, then you'll receive a new ID card, but you may continue to use the same debit card. Under the UC Medicare PPO, you use two ID cards, and you probably won't, if you're continuing, you won't receive a new member ID card. Sorry, it's just difficult for me to keep all of this information straight in my head. UC Medicare Choice members will receive all new ID cards with the new copay information printed on them. So if you have an Anthem plan, you're continuing with Anthem, you will have two ID cards sent to you, and you should replace your current ID cards with the new ID cards that arrive in the mail. Moving on, this next slide is to describe where to receive care that's covered by your medical plan in Santa Cruz County. So I've kind of reversed the order here, and this is a chart which shows main providers in Santa Cruz County that are available by which plan. And I'm including this chart because folks often ask me, which plan gets me to be able to see my preferred doctor? So whatever medical plan that you have, there's an undeniable shortage of doctors in Santa Cruz County, especially the doctors that provide primary care, and especially doctors that provide primary care for older adults. So it is always prudent to call the doctor to ensure they can accept you as a new patient. If you're covered under an HMO plan or a Medicare Advantage plan, the requirements around managed care may allow for easier access than under PPO plans or Medicare supplement plans. I wish I could change that condition. It's part of a nationwide situation in limited access to primary care, and it will continue for some time. I have had reports that Medicare supplement plans are no longer being accepted by primary care physicians at Palo Alto Medical Foundation and Dignity, and that has been affirmed. This is due to patient rolls for Medicare members being at capacity. It's just a difficult health environment out there. And some services may only be available by traveling outside of Santa Cruz County. I'm going to move on to the medical plans and contribution rates. To confirm, UC's funding strategy for retiree medical remains constant with an aggregate of 70% UC contribution, and that applies to both Medicare and non-Medicare covered retirees and their family members. For retirees outside of California, UC funds an HRA annually, and the contribution is up to $4,000 per person per year. This is an increase of $1,000 over last year. And the open enrollment publications do not have the rates subject to graduated eligibility. For that, you can log into UC Raise to view your actual costs. So this is a chart showing the retiree premiums for those under 65, so our early retirees, and the retiree premiums reflect a reduction for UC Care, and that's mainly due to having a new carrier. There's our modest increases for UC Blue and Gold, and more significant increases to Kaiser. This chart shows the changes when all family members are in Medicare. UC Medicare Choice with United Healthcare, Medicare Advantage plan, has significant increases this year compared to the 2025 rates. To confirm, this plan is not being pulled from the market. Some individual plans offered on the open Medicare marketplace are leaving the area. That does not apply to UC's group plan with a larger risk pool. In 2026, Kaiser Permanente Senior Advantage is stable. It has a $0 premium, and the Part B reimbursement is, as usual, matched to the current year's base Medicare Part B premium. UC Medicare PPO premiums are going down, which is a pleasant surprise to me. And UC's high option plan is going up significantly in 2026. This chart shows the rates for those members over age 65 and not eligible for Medicare because they did not participate in Social Security, which is just a fraction of the population. Since Health Savings Plus is a new plan, contributions will be about an average of what they are between core and Health Savings Plan. And I'll stop here for a chat for questions if there are any that came in. Doesn't seem like there's any.
I don't see. I've been trying to answer them as we go along. A lot of them are, costs questions.
Yeah. Okay, that's understandable. Okay. So on to the non-medical plans. Delta Dental will continue to be the insurance carrier for both dental plans offered by UC. So earlier this year, UC conducted a comprehensive dental RFP or request for proposal to evaluate our plans and our provider networks. A key finding was that provider terminations are not unique to the Delta Dental plan, but are rather a trend across the entire dental industry. So dentists are simply leaving dental networks. They're not accepting any insurance plans. And that just is a trend that is nationwide. And we are feeling it here in Santa Cruz County for certain. So the goal is to help support members through these changes and help minimize disruption to people's care when UC understands that people like to stay with the same dentist. So there's going to be some enhancements that are going to be added. For the Delta Care plan, the Delta Care USA is a dental HMO, and its plan design will remain unchanged for 2025. There remains very limited access in Santa Cruz County, and both plans are open for enrollment. So these are the enhancements for the Delta Dental PPO plan that I mentioned. And these are added by UC to ease the impact of network changes, dentists leaving the dental plan network. Beginning in January 1, 2026, UC is introducing enhanced coverage for members receiving care from premier providers and out-of-network providers. So what will happen is that, again, beginning January 1st, maximum contract allowance limits for sealants, root canals, gum disease, oral surgery, all of those kind of routinely used things are going up from 75% to 80%. And these enhancements are designed to provide financial relief to those that seek treatment from out-of-network providers. And as a reminder, the in-network providers will still offer the highest value. So I've linked the Find a in-network provider on this page for folks to look for in-network providers. But if you like to stay with your dentist and your dentist has left the Delta Dental Network, in 2026, there may be a little bit more coverage available for you. So we anticipate that this will help about 29,000 users of the Delta Dental plan who are going to out-of-network dentists. VSP continues to be the insurance carrier for UC optical insurance coverage. There are no benefit changes for 2026. There will be a 2% increase in premiums for retirees. The increased cost is driven by, industry trends, and the pandemic, continues to have caused artificially low utilization. And so there's now the rebound effect. So those rates are going up 2%, which is, less than $1 for most coverage levels. And you can contact VSP directly to enroll. There are no premium increases for the new year. The ARAG plan is open. And if you would like to add this plan, you can enroll or add that plan for 2026 via UC Raise, and those premiums are deducted from your pension check. Nationwide continues to be the pet insurance carrier at the UC discounted rate. Enrollment is always open, and you can contact Nationwide directly for a quote and pay Nationwide directly for coverage that you receive for your pet. And UC is maintaining our relationship with Experian, our identity theft protection plan administrator. Experian is offering a class to bridge the financial literacy gap. So Experian recently launched the Credit College program, an interactive course designed to help members understand and improve their credit knowledge and also how to protect their credit. Otherwise, there's no changes for the monitoring service, and UC continues to pay the full premium for retirees and dependent children up to age 18. And finally, UC continues to partner with Find Help, a network of social assistance programs and resources. I'm including this because I know that the government shutdown is affecting people. So there may be ability to find help with social services, and this is included in is bundled with your medical coverage. If you're covered under UC Medical, you can connect with Find Help to receive help. And that ends the formal presentation, but I will stick around to answer questions, and we'll turn to test now to see if there are some.
A couple questions came in, and it looks like we have some participants that are helping as we go along here too. But this is a great question. Earlier, you mentioned some PAMP docs not accepting patients with Medicare supplement plans. Is that just for new PAMP patients and not for existing PAMP Medicare patients?
Yes, that is for, I could have been clearer on that. That is for new care. So if you are not already seeing a physician and you want to get in with a PAMP doctor, you may encounter difficulty. I'm not saying that the door is closed. I'm always of the opinion that you should just reach out and ask. But I understand that doctors at both Palo Alto Medical Foundation and Dignity Health are limiting the number of primary care patients they can take on as new patients, and especially new patients that are covered by a Medicare supplement plan.
Yeah, and I know that you've mentioned this in the past. If you haven't seen your regular doctor in a period of time, it's a good idea, correct, to make those appointments, update your relationship with that doctor and, physicals and all that stuff so that you maintain that relationship. Correct, Marianne?
Absolutely correct. Yes, you can become a former patient, that doctor, if you don't see them routinely. So keeping that patient-doctor relationship is key to keeping current as a current member of their patient roles. So that's, seeing the doctor at least, every once a year, I would say.
Another question came in. What is a hearing aid coverage with Medicare and high option supplement? That's available in your explanation of benefits, which is also available from the UCNet site. It goes into the great detail about the hearing aid coverage, depending on what plan that you choose.
Yes, and that would be covered under medically necessary care. It's not covered, hearing aids aren't covered by Medicare. So Medicare doesn't cover anything to do with hearing aids. So in that case, your high option deductible would apply. And then the cost for that hearing aid would be covered by the plan according to the provision of the plan, which is a percentage based up to a maximum, I believe, of $3,000 per year. I don't have that memorized, but I believe that is an accurate amount. But oftentimes hearing aids can exceed that cost. So it would depend upon, you would receive a bill for the cost of that hearing aid once you've
and
obtained
it's
it.
in the explanation of benefits. Detailed information can be found there specifically about
Yes.
hearing aids. The next question is Experian covered for employees but not retirees?
No, it's covered for employees too.
Or
But
for
this
retirees,
is
right?
it's
Employees
for
and
retirees
retirees.
and employees, but this is a retiree presentation. So I mentioned retirees.
And then another question about hearing aids, again, explanation of benefits. How can I find how much my Medicare deductions will be from my Social Security benefit payment?
Go to your Social Security check stub. So that's usually go online to the Social Security Administration website and you can view your monthly income statement with any deductions for Medicare.
And they will also notify you about increases in coming years.
Mm-hmm.
Wow.
Yep.
That.
Yeah, UC is not involved in your Social Security check at all. We don't have access to your Social Security check. That is your personal, private financial information.
Hey, any other questions out there? I'm monitoring the chat. If you're with a PAMF doctor and are currently on a Medicare Advantage plan and switch back to original Medicare with a Medicare supplement, is it likely you will be considered a new Medicare patient?
I wouldn't think so as long as you're receiving continuing care. But in that case, contact your doctor and ask them.
Any other questions?
Well, I'll stick around for a few minutes yet. But I do want to take this opportunity to thank you for listening to me. And I want to thank Tess and acknowledge your wonderful help today. We're working really hard to bring you open enrollment information. And, this is a big change year, especially for folks covered under the UC PPO plans. So understand there are a lot of questions. We're doing our best to keep up with all of the questions that are coming into us. Your patience is really appreciated at this busy time. We will get to you. But just thank you and for your attention and interest, and I appreciate all of your help.